In this video, we're going to look at a crash cart and a defibrillator. So this would be a typical start of the day and some safety checks that you would perform in a critical care setting, for example, an emergency ICU, CCU, cardiac surgery, and so on. So this is my crash cart here. It's locked right now, so I'm going to turn it around for you. So you have medications in the drawers, and they're usually stocked according to your unit protocol and medications that would be most used in your unit. But of course, you will find epinephrine, lidocaine, amiodarone, and that type of cardiac medication in each crash cart. You have a cardiac board. And whenever you have to use the crash cart that is of this type, you have to remove the cardiac board first. And if you're using a crash cart, chances are that you might need the board as well. So you would either take it out and put it aside, or you would actually use it to start giving CPR to a patient. That being said, stretchers in the emergency department do not need cardiac boards because they are CPR compatible beds, so you can just push a button to drop the bed down and start giving CPR without a cardiac board. So now I can look at my crash cart. It's usually filled with medication, as I was saying. It also usually has a compartment for your respiratory therapist. And it has a few useful things such as bags of saline and bags of most common medication solutions that you would be using on your unit. All the emergency cardiac medications will usually be in the top compartment here that you can slide open. And you see I have my epinephrine, I have my lidocaine, atropine, amiodarone, and so on up here. So these are all the jet injectable medications. Now, let's have a quick look at the defibrillator. Each morning when you start working in critical care, you would have to check your defibrillator to make sure it's functioning properly. This should be done at least every 24 hours. In some places, you will do it every shift. Normally, when I'm looking at a defibrillator, I check whether or not there is a little green mark here, because that means that it had been checked and it's functioning properly recently. But I will show you how this is done. So you always have to be careful with a defibrillator. This is a real machine that can shock you. So you have to make sure that none of the connections are loose. And even when you're doing a safety check on your defibrillator, the paddles have to be snugly in place. Okay. I'm going to turn on the defibrillator. There are different settings on the knobs. Arrêt or stop is usually when it's off. So if I want to defibrillate a patient, I will go to the defibrillation setting. There's also a pacer setting, and there's a monitor setting. So there are different capabilities that this defibrillator can do for us. We can pace a patient, we can defibrillate or cardiovert, and we can also just monitor a patient by using special defibrillator EKG leads or pads. Okay, so I'm going to turn it on because what I want to do now is I want to do a safety check. Okay, so automatically this is a biphasic defibrillator. Most of our hospitals use biphasic defibrillators now, so you don't need to worry about monophasic. It's just a difference in the type of current that the defibrillator gives to your patient. Monophasic means that the current goes in one direction only, and biphasic, which is the more modern machines that are mostly used in all the hospitals, is where the current goes there and back. Okay, so that's why it's called biphasic. So this is a biphasic defibrillator, and you see automatically it's set to defibrillate at 120 joules, which is the starting point for most defibrillations that happen in an emergency. You can go from 120 joules to 200 joules. Right now, I'm just going to do the safety check. So what I'm going to do is I'm actually going to decrease the energy of my electricity, my stimulation, to 30. Okay, so this is the button to decrease, and you will see that the joules here are going down, so I'm going to come down all the way to 30. Okay, then I'm going to say charge. Okay, it says defibrillation 30 joules ready. I make sure nothing is touching anything else. And what I'm going to do next is I'm going to discharge the pads here. by pushing the red buttons. Okay, so now my monitor tells me 30 joule test okay, which means that the defibrillator is functioning properly. And I can also look at the printout where I see a very nice spike, which tells me also that the defibrillator discharged correctly. So normally I would leave this paper attached here and I would write with my pen the date and time of when I had tested the defibrillator, and I would leave it there so the next nurse or anybody else coming into the room knows when it was tested and then the defibrillator is functional. Once I am done, I'm going to turn it off back to here and my safety check is done.